Hi, I'm Dr. Ethan Feldman, Director of Back in Action Chiropractic Clinic. I would like to talk to you today about the two most common causes of low back pain in the United States and what you can do to prevent them and what you should do to deal with them when you have them, if you have them. The most common cause of low back pain is someone bending over incorrectly. It stresses the spine and the muscles get pulled too far and they tear and there's injury. So people have been bending over for millions of years without a problem. Why is it that we have such a problem with people bending over here in the United States in our society? Well, it has to do with we're not used to it and there's a right way and a wrong way to do it. Here the spine is very strong. There's essentially like a bow and arrow, a line that goes from here to here that then gets stretched and stretched and stretched. So it has to reach much further instead of being here where it's stronger. Ask yourself, if you had a bunch of strings like this and then you lean forward, would it be strong? Probably. But if you bent it like this, so it was bending the other way, and then took on a load, it would probably break. But let's talk about sitting. This is the #2 cause of back pain. Many chiropractors work on athletes, and the #1 injury is too much of an activity. Many chiropractors work on office workers. That's not too much activity, that's too little activity. It puts strain in other ways. Pelvis is a beautiful piece of architecture. When we're standing, the weight comes up through this leg, and then it has this angle here. And this angle creates a force that goes perpendicularly into this slice of this is called the sacrum, this triangular structure. So the more force that comes up from the legs, the more it pushes the whole structure together. But when we sit, the force instead comes through the sits bones here. Instead of having a perpendicular line, we have a shear, a parallel line of force. So no longer do we have that packing together. And what happens is the ligaments start to get stressed, and over time they will get loose. And one side or the other will cause the spine to slip out of place and usually rotate at the same time. If you do come down with low back pain or know someone who does have low back pain, the question you have to ask yourself is, what am I going to do about this? What's the most effective thing that I can do? Perhaps you've tried rest, perhaps you've tried aspirin, and here you still are having the problem. The U.S. Department of Health published a study for acute low back problems in adults where they looked at what was the most effective treatment. Spinal manipulation. Spinal manipulation is what chiropractors do. Why does it work so well? Well, if you bend down and pick something up and you ratchet something out of place, it needs to get put back. If you are sitting for a very long period of time and it coaxes the ligaments into a stretched and painful place, the ligaments need to be brought back, the alignment needs to be brought back to the pelvis.